Hi guys, today I will answer some question about incontinence in gynecology. First question, 55-year-old woman with a history of multiple vaginal delivery present with the complaint of urine leakage during physical activity and sudden strong urge to urinate. The urodynamic study show a normal bladder capacity, low bladder compliance, and arousal overactivity. The most likely diagnosis is multiple vaginal delivery is risk factor. During what? During physical activity, such as coughing or any activity. And sudden strong urge to urinate. Arousal overactivity. The most likely diagnosis is mixed stress plus urge continence. Second question is 62-year-old woman with history of pelvic radiation therapy report a sudden to strong urge to urinate, often leading to incontinence and sensation of incomplete bladder empty. The urodynamic study show a low bladder compliance and arousal overactivity. The most likely diagnosed history of pelvic radiation therapy is a risk factor. Strong urge to urinate, sensation incomplete bladder empty. The urodynamic study show low bladder compliance and arousal overactivity. Diagnosis is overactivity bladder اللي هي شنو؟ urge incontinence. Third question is 48-year-old woman with a history of multiple pelvic surgery. Report urine leakage during physical activity, coughing and sneezing, as well as a sudden strong urge to urinate. The urodynamic study show a normal bladder capacity, normal bladder compliance, and arousal overactivity. The most likely diagnosis is multiple pelvic surgery is risk factor. Leakage during physical activity, coughing and sneezing. Sudden and strong urgency. This is urge incontinence. The urodynamic study is the capacity normal compliance, and arousal overactivity is urge incontinence. The most likely diagnosis is mixed stress plus urge incontinence. Fourth question is 58-year-old woman with a history of diabetic mellitus report a sudden strong urge to urinate, often leading to incontinence and difficulty initiation urination. The urodynamic study show low bladder compliance and arousal overactivity. The most likely diagnosis is diabetes mellitus risk factor. Sudden and strong urge to urinate. This is urge incontinence. Overactive bladder, stress, urinary incontinence, mixed urinary tension. Fifth question is 65-year-old woman with history of neurological disorder report constant dribbling of urine and sense of incomplete bladder empty. The urodynamic study show low bladder compliance and arousal underactivity. The most likely diagnosis is history of neurological disorder, constant dribbling of urine. This is overflow incontinence. Sense of incomplete bladder empty. The urodynamic study bladder compliance is low and arousal underactivity. This is important. Overactivity bladder is no. Stress urinary incontinence, no. Mixed urinary incontinence, no. Urinary retention, mean overflow incontinence. Sixth question is 52-year-old woman with a history of multiple vaginal delivery present with the 6 complaint of urine leakage during physical activity and sudden strong urge to urinate. The urodynamic study show normal bladder capacity, normal bladder compliance, and arousal activity. This is easy. Arousal overactivity. Multiple vaginal delivery present with 6 complaint of urine leakage during physical activity and sudden strong urge to urinate. This is mixed stress and plus urge incontinence. Thank you for everyone.